Ezetimibe is a medication trusted by many doctors to help lower cholesterol, either on its own or in combination with statins, especially for people who need extra help reaching their cholesterol targets. It works by reducing the absorption of cholesterol in the small intestine, which in turn lowers the amount circulating in the blood. For many patients, this means a reduced risk of heart attack and stroke and a better outlook for long-term cardiovascular health. But like any medication, ezetimibe is not without potential side effects. While most people tolerate it well, some may experience symptoms that could signal the body is not reacting as expected. The tricky part is that these side effects are often subtle at first, and it's easy to mistake them for everyday fatigue, minor digestive upset, or simply the natural aches of aging. Recognizing the early signs can make all the difference in managing them effectively, adjusting treatment if needed, and preventing more serious complications. In this video, we'll uncover 6 of the most important side effects of ezetimibe that you should never ignore. You'll learn what to watch for, why they happen, and the simple but important steps you can take to protect your health while continuing to benefit from this cholesterol-lowering therapy. Let's start with one of the most commonly discussed concerns: muscle pain and weakness. 1. Muscle pain and weakness. Muscle pain and weakness are among the most frequently reported side effects of cholesterol-lowering drugs, and while ezetimibe is generally less likely than statins to cause these problems, it can still trigger them in some people. The discomfort may present as a dull ache, soreness, or stiffness, often in the thighs, calves, shoulders, or lower back. For some, it may feel like post-exercise soreness that never fully goes away, while for others, it can develop suddenly and be severe enough to limit daily activities. The exact reason why ezetimibe can cause muscle issues is not fully understood, but it may be related to changes in how the body processes fats and energy within muscle cells, especially when ezetimibe is combined with statins. In rare but serious cases, muscle symptoms could be an early warning sign of rhabdomyolysis, a dangerous breakdown of muscle tissue that releases a protein called myoglobin into the bloodstream, which can damage the kidneys. Warning signs include extreme weakness, swelling in the muscles, severe pain, and dark-colored urine. This requires immediate medical attention. If you experience mild muscle pain, it's important to track when it happens, how long it lasts, and whether it gets worse with physical activity. Sometimes adjusting the dosage, changing the timing of the medication, or switching to ezetimibe alone without a statin can relieve the symptoms. Lifestyle measures can also help support muscle health while on cholesterol-lowering therapy. Staying well hydrated, eating a nutrient-rich diet with adequate protein, and including foods high in magnesium and potassium can help muscles function properly. Gentle stretching and low-impact exercises such as walking, swimming, or yoga can also improve flexibility and reduce stiffness. If you've been prescribed coenzyme Q10 by your doctor, this supplement may also help alleviate statin-related muscle pain, though its benefits with ezetimibe alone are less clear. The most important thing is not to ignore persistent or worsening muscle pain, as catching it early allows you and your healthcare provider to make changes before it becomes a bigger problem. Next, we'll look at a side effect that affects one of the most important organs involved in processing medications: your liver. 2. Liver function changes. The liver is one of the most important organs for processing medications, and ezetimibe is no exception. Once ingested, this drug passes through the digestive tract and is absorbed into the bloodstream, where it reaches the liver for further metabolism. In some individuals, this process can cause changes in liver function, which are often detected through elevated levels of enzymes such as ALT, alanine aminotransferase, and AST, aspartate aminotransferase, in blood tests. These enzymes are markers of liver health, and when their levels are higher than normal, it may suggest inflammation or irritation in liver tissue. For most people, these changes are mild, temporary, and do not lead to serious harm. But in certain cases, they can be an early sign of more significant liver problems. People who take ezetimibe in combination with statins are more likely to experience enzyme elevations, as both medications are metabolized in the liver. This is why doctors often recommend liver function tests before starting treatment and periodically during use, especially in the first year. Symptoms of more serious liver injury include persistent fatigue, unexplained weakness, nausea, vomiting, loss of appetite, discomfort, or pain in the upper right side of the abdomen, dark-colored urine, pale or clay-colored stools, and yellowing of the skin or eyes, known as jaundice. If you notice any of these warning signs, it is crucial to contact your healthcare provider immediately. Certain factors can increase the risk of liver problems while taking ezetimibe. Heavy alcohol consumption, pre-existing liver disease, obesity, and the use of multiple medications that are processed by the liver all place additional strain on this organ. To help protect your liver, limit or avoid alcohol, maintain a healthy body weight, and follow a diet that supports liver health. Whole foods such as vegetables, fruits, whole grains, lean proteins, and healthy fats like olive oil can help reduce inflammation and support liver regeneration. Antioxidant-rich foods, including berries, spinach, kale, and nuts, can also promote liver cell repair. Staying hydrated is equally important as it aids the body in filtering and eliminating toxins. In most cases, the benefits of ezetimibe in lowering LDL cholesterol and reducing the risk of cardiovascular events outweigh the risk of liver function changes. However, regular monitoring is essential, as liver issues often progress silently in the early stages. Being proactive, attending checkups, and discussing any unusual symptoms promptly can ensure that any liver concerns are addressed early, allowing you to continue benefiting from the medication without compromising your long-term health. In the next section, we'll explore how ezetimibe can sometimes affect your digestive system, leading to discomfort that may interfere with daily life. 3. Digestive problems. Nausea, diarrhea, bloating. Digestive discomfort is another side effect that some people may notice when taking ezetimibe. Although it's generally considered a well-tolerated medication, it can sometimes irritate the digestive system, leading to symptoms such as nausea, diarrhea, bloating, or abdominal discomfort. These issues may occur shortly after starting the medication or after a dose adjustment. In most cases, they are mild and temporary, improving as the body adjusts. However, for a smaller group of patients, the symptoms can persist and interfere with daily life. Nausea may feel like a lingering, unsettled stomach, sometimes accompanied by a reduced appetite. Diarrhea, when it occurs, can range from loose stools a few times a day to more frequent and urgent episodes, which can lead to dehydration if not addressed. Bloating or abdominal discomfort may feel like pressure or cramping, often making it uncomfortable to eat large meals. These effects are generally not dangerous on their own, but can become problematic if they persist. Drinking plenty of water, eating smaller meals, and avoiding foods that are greasy, spicy, or heavily processed can help ease symptoms. Some people find that taking ezetimibe with food reduces nausea, while others feel better taking it on an empty stomach. It's worth discussing the best approach with a doctor. Persistent or severe digestive symptoms should not be ignored, especially if they are accompanied by blood in the stool, black tarry stools, severe abdominal pain, or unintentional weight loss, as these could indicate other underlying problems. Your doctor may adjust the dosage, change the timing of the medication, or switch you to a different cholesterol-lowering treatment if side effects are significant. While digestive side effects are typically mild and manageable, addressing them early can make it easier to continue benefiting from the cholesterol-lowering effects of ezetimibe without compromising your comfort and quality of life. In the next section, we'll discuss how some people may develop allergic reactions to this medication, which can range from mild skin irritation to potentially serious breathing issues. 4. Allergic reactions, rash, swelling, breathing issues. Although rare, allergic reactions to ezetimibe can occur and should always be taken seriously. These reactions can range from mild skin irritation to severe and potentially life-threatening symptoms. The most common form of allergic response is a skin rash, which may appear as red, itchy patches, hives, or small bumps. Sometimes the rash is mild and fades on its own, but if it spreads, becomes intensely itchy, or is accompanied by swelling, it could indicate a more significant reaction. Swelling, known as angioedema, may affect the face, lips, tongue, or throat. This can happen suddenly and, in severe cases, make it difficult to breathe or swallow. Shortness of breath, wheezing, or tightness in the chest are signs of a potentially life-threatening allergic reaction called anaphylaxis, which requires immediate emergency medical attention. These reactions can happen shortly after taking a dose or may develop after repeated exposure to the medication. Individuals who have experienced allergic reactions to other cholesterol-lowering drugs or who have a history of severe allergies may be at a higher risk. If you suspect an allergic reaction, stop taking ezetimibe and seek medical help right away. Even mild symptoms should be discussed with a doctor, as they may recommend discontinuing the medication or switching to an alternative treatment. Managing mild reactions may involve antihistamines or topical creams to relieve itching, but these should only be used under medical supervision. It's also important to inform your healthcare provider about any allergies or sensitivities you have before starting ezetimibe, as well as any other medications or supplements you're taking, to reduce the risk of interactions that could worsen a reaction. While allergic responses to ezetimibe are not common, knowing the signs and acting quickly can prevent complications and ensure your safety. In our next section, we'll move on to another side effect that, while less dramatic, can still have a noticeable impact on your quality of life: fatigue and unusual tiredness. Film 5. Fatigue and unusual tiredness. Fatigue and unusual tiredness may not be the first side effects people associate with ezetimibe, but for some individuals, they can be among the most frustrating. This isn't just the normal end-of-the-day tiredness we all feel. It's a deeper, more persistent exhaustion that can make simple daily tasks feel like a challenge. Some patients describe it as a constant heaviness in the body or a foggy state of mind, where even after a full night's sleep, energy levels don't bounce back the way they used to. The exact reason why ezetimibe can cause fatigue isn't fully understood, but there are several possible explanations. One theory is that cholesterol plays an important role in the body beyond just being a heart risk factor. It's a building block for hormones and a key component of cell membranes. By reducing cholesterol absorption, ezetimibe may indirectly influence hormone production or cellular energy balance, which could lead to a feeling of reduced vitality. Another factor is that ezetimibe is often prescribed alongside statins. While this combination is effective in lowering cholesterol, statins are known to sometimes cause muscle aches and inflammation, both of which can contribute to feeling drained. When muscle soreness and fatigue occur together, people often reduce their physical activity, which unfortunately can make tiredness even worse over time. Fatigue linked to ezetimibe can also be subtle, creeping in gradually, making it hard for patients to notice the connection right away. It may start with mild sluggishness in the afternoons, reduced motivation to exercise, or a tendency to feel sleepy earlier in the evening. If ignored, it can progress to the point where it impacts work performance, social interactions, and overall quality of life. Addressing fatigue begins with open communication with a healthcare provider. Your doctor can rule out other common causes of tiredness, such as anemia, thyroid disorders, or low vitamin D levels, which are treatable conditions that can coexist with medication-related fatigue. In some cases, adjusting the timing of the dose or trying ezetimibe without a statin for a short period may help identify the true source of the problem. Lifestyle adjustments can also make a significant difference. Staying hydrated supports metabolism and circulation, while a balanced diet rich in whole foods, lean proteins, healthy fats, and complex carbohydrates can help maintain steady energy. Incorporating light to moderate exercise, such as walking, yoga, or swimming, can improve stamina without overexertion. It's also important to prioritize quality sleep by keeping a consistent bedtime and creating a restful environment. While fatigue from ezetimibe is not common and is usually reversible, it should not be dismissed. Recognizing the symptoms early and working with your doctor to address them ensures you can continue lowering cholesterol effectively while preserving your energy and zest for life. In the next section, we'll explore how ezetimibe, especially when taken with statins, can increase the likelihood of certain side effects through drug interactions. 6. Interaction risks when combined with statins. Ezetimibe is often prescribed alongside statins for patients whose cholesterol levels remain high despite lifestyle changes and statin therapy alone. This combination can be highly effective, as the two medications work in different ways. Statins reduce the liver's production of cholesterol, while ezetimibe decreases the absorption of cholesterol from the intestine. However, while the dual approach can significantly lower LDL cholesterol, it can also increase the risk of certain side effects, particularly those involving muscles and the liver. Muscle-related issues, such as myalgia, muscle aches, stiffness, or weakness, are more common when ezetimibe is combined with statins than when either drug is taken alone. In rare but serious cases, this combination can lead to rhabdomyolysis, a dangerous breakdown of muscle tissue that can cause kidney damage. Symptoms like severe muscle pain, tenderness, swelling, or dark-colored urine should be treated as urgent warning signs and require immediate medical evaluation. Another concern with combining ezetimibe and statins is the potential for elevated liver enzymes, indicating liver stress or damage. Both drugs are processed in the liver, and taking them together can increase the workload on this organ. While most people tolerate the combination without problems, regular liver function tests are essential to catch any changes early. Patients with a history of liver disease or heavy alcohol use may need closer monitoring or alternative treatments. Drug interactions aren't limited to just statins. Other medications metabolized by the liver, such as certain antibiotics, antifungals, or immune-suppressing drugs, may also increase the risk of side effects when taken with ezetimibe and statins. For this reason, it's critical to share a full list of all prescription drugs, over-the-counter medications, and supplements with your healthcare provider before starting therapy. To minimize the risks, doctors often start patients on the lowest effective dose of each drug and adjust based on response and side effect profile. They may also recommend lifestyle measures such as maintaining hydration, eating a nutrient-rich diet, and incorporating gentle exercise to support muscle health. If side effects do appear, options include lowering the statin dose, switching to a different statin with a lower risk of muscle problems, or continuing cholesterol control with ezetimibe alone. While the combination of ezetimibe and statins remains a valuable tool in reducing cardiovascular risk, awareness and monitoring are key to ensuring it works safely for you. In the next section, we'll recap the key points and discuss what to do if you notice any of these side effects, so you can protect your health without compromising your treatment goals. Ezetimibe can be a powerful ally in lowering cholesterol and protecting heart health, but like all medications, it comes with the possibility of side effects. Throughout this video, we've covered 6 important issues to watch for: muscle pain and weakness, liver function changes, digestive discomfort, allergic reactions, persistent fatigue, and increased risk when combined with statins. Most of these effects are rare or mild, but being aware of them allows you to act early and avoid more serious complications. The key to safe and effective use is regular monitoring and open communication with your healthcare provider. Keep track of any unusual symptoms, follow your prescribed dose carefully, and maintain a healthy lifestyle to support your treatment. If you notice warning signs such as severe muscle pain, yellowing of the skin, swelling of the face or throat, or persistent digestive issues, seek medical advice promptly. Remember, medication is only one part of the picture. Diet, exercise, and overall wellness play a huge role in your heart health. If you found this information helpful, we'd love for you to join our MediMint community. Subscribe to our channel for more clear, trustworthy health guidance and turn on notifications so you never miss a new video. Leave a comment below sharing your experiences with ezetimibe or your questions about cholesterol management. Your story might help someone else on their health journey, and if you know someone who could benefit from this video, share it with them. Together, we can make informed choices and live healthier, stronger lives.